Hey everyone, it's been a hot minute since I've been on Facebook Live. Good Friday afternoon to everyone. Today I'm going to be talking about a relatively new advanced prostate cancer drug, if you will. It's another Leuprolide, except it's not a Leuprolide acetate, it's a Leuprolide mesylate. And the brand name is called Camcevi, C-A-M-C-E-V-I. This is another Leuprolide formulation, except there's some minor differences, and I want compared to the existing ones, Lupron, Eligard, Trelstar. So I want to highlight some of those differences and talk about the coding and billing aspects and some of the changes that are coming up in just a couple of weeks from CMS. So Camcevi is known as Leuprolide mesylate, and it comes in a 42 milligram formulation. Unlike the other types of LHRH agonists, this one has only a 6-month formulation available currently. So if you have a 1 month, 3 month, or 4 month, unfortunately, those formulations of Camcevi are not coming out until probably Q4 or Q3 2023. So you will only be able to deliver currently Camcevi 42 milligram, which is a 6-month formulation. That said, it is a 42 milligram dose. And as you know, when you purchase the drug, you get the pricing or the reimbursement pricing from CMS. And believe it or not, the Q1 2023 CMS ASP drug price list just dropped yesterday. So if you go to CMS, you'll be able to find the CMS's latest pricing that's coming up for 2023. Camcevi, Leuprolide mesylate, Camcevi 42 milligram, was under wholesale acquisition cost, WAC pricing. That is changing in a couple of weeks when ASP goes into effect. The new pricing, the ASP per unit pricing from CMS in Q1 2023 will be 88.751 per unit. And you multiply by that by 42, you get 3727.54 for a 42 milligram injection. And currently, those of you who are on UroGPO, and if you're not, you should be on UroGPO. For small practices, you can get Camcevi through UroGPO, and you can get the pricing there as far as your cost. But this company is pretty strategic in the way they are structuring things, in the way they are distributing this medication, so they're not killing themselves by racing to the bottom, if you know what I'm talking about here. The injection code, the medication code is J1952. J1952. It's unique to Camcevi, so you should not be using the other Leuprolide drug codes when you deliver Camcevi, because the reporting is different, the code's different, the reimbursement is different, so you need to be extremely diligent in making sure you're using the correct code. Camcevi is an emulsion, so it's different than the current formulations of Leuprolide. It is given not IM, but subcutaneously. You guys can read up on Camcevi's website about the studies where they looked at 137 patients. They were able to achieve castrate level testosterone less than 50 nanograms per deciliter by week 4. And for testosterone less than 20 nanograms per deciliter by week 4, they are able to achieve that for 70% of the patients in their 137 patient study. It's in essence, clinically, I anticipate that this to be the same as all the other Leuprolide as far as efficacy goes, as far as castration. And also in their clinical study, there were no breakthroughs, no testosterone breakthroughs while the patients were under Camcevi treatment. So January 1st, ASP is coming out. Just want to remind everyone, make sure you look at the pricing for all your drugs, not just Camcevi. Let's see. As far as injection for this medication, it comes in a pre-filled syringe. This is a big plus for me in my practice because my MAs no longer have to mix anything. The only thing you have to do is Camcevi is kept in a refrigerated state, not frozen, refrigerated. You basically want to take it out of refrigeration in anticipation of providing this injection to a patient. Let it thaw, or not thaw, but let it warm up to room temperature, if you will. You're not thawing anything. You're just letting it warm up to room temperature by leaving it out for about 30 minutes before the patient comes in. Then the injection is done subcutaneously through an 18-gauge, 5/8 inch needle. It's an 18-gauge needle because it is an emulsion, so you have to use a larger caliber needle to deliver the medication. But you pinch the skin, go in 90 degrees, make sure you're subcutaneous, deliver the injection, you're done. No mixing. That's a big plus for me, for my practice, for my medical assistants, because anytime you have to mix anything, there's always a chance of issues. And we've had in the past where this syringe or the medication for one of the other leuprolides it was so gunked up, it would not deliver. So we end up with a very expensive drug that we could not deliver to a patient. And that is always an issue in the past. This, I anticipate, will be a lot easier, a lot simpler. We don't have to mix anything. You basically screw in the plunger into the syringe, attach the needle, let it warm up to room temperature, deliver it at a 90-degree angle from the skin, subcutaneously, easy peasy, and you are done. All right, so subcutaneous injection. Only 11% of patients had injection site reaction, so that's pretty darn low. As with anything else, any of these LHRH agonists, the side effect profile is pretty much the same, hot flashes, etc. And let's see, you would deliver it in the upper or mid abdomen above the belt line. So these are some of the things that you need to consider when you are implementing Camcevi into your practice. This drug is manufactured in Paris. So far, no supply chain issues, and you should be able to get this medication. This medication was launched in March of 2022. I believe it was approved in November of 2021. So it's a relatively new medication, and the pricing is currently favorable. Clinically, it's efficacious, so you may want to consider looking into it. From a workflow perspective, I think it's advantageous because we don't have to mix anything, less chance of the medication being gunked up in the syringe, and you have to deal with returns and all that good stuff. And lastly, of course, payment for the patient. This is ideal for a patient who's on Medicare. As usual, prostate cancer is usually an older man's problem. So these guys are typically Medicare patients. If they have a Medicare Part B and also a supplement, they're set. Patient set. Now, if the patient has private insurance, there is a service through Camcevi's parent company called AccordCaresPortal.com. And no matter what, if the patient has traditional Medicare and supplement or private insurance, you should send everything through the benefits verification service via AccordCarePortal.com. And I'll put the link in the comments so that you can make sure that everybody's on board. The patient's going to understand how much he or is going to owe or not owe, and make sure you, as a practice, will be appropriately reimbursed for delivering the service, and everybody is happy. So I know on October 25th, that's when we saw the first post about Camcevi in the Thriving Urology Practice Facebook group. Someone else also mentioned that the ASP pricing is coming. Yes, it will be coming from CMS January 1st, 2023. I will also link the site, the files from CMS in the description, in the comment section, so that you can have access to the Q1 2023 ASP pricing for not just Camcevi, but for all the other medications. As usual, if you have any comments or questions, or if you have already used Camcevi, please let me know in the comments your experience so that you can share with other members of the Thriving Urology Practice Facebook group. And lastly, I want to welcome everyone for joining. I know we are over 2,000 members strong, so thank you all for being such amazing, amazing people sharing your comments, insights, and suggestions on how to run your practices better so that we can all benefit. Lastly, take care of yourself, take care of each other, and thank you for the privilege of your time. Bye-bye.